Hi, everybody. Thank you for joining us today. Welcome to the Medicare is Better Than Ever tour. Stop here in Harrisburg. Traveling over 7,000 miles across 10 states in 3 weeks, Protect Our Care's Medicaravan, which is parked outside, is going coast to coast to make sure every senior on Medicare understands the new savings thanks to the Inflation Reduction Act. I'm Michael Berman with Protect Our Care here in Pennsylvania. Today, I'm very excited to be joined by Mayor Wanda Williams, Lieutenant Governor. Yes. Lieutenant Governor Austin Davis, Dauphin County Commissioner George Hartwick, and Christy Martin with Medicare CMS, the Senior Advisor CMS. So, under the Inflation Reduction Act, insulin costs are capped at $35 a month today. Vaccine like shingles are free, and drug companies cannot hike drug costs more than the rate of inflation. That's already happened today. Starting in 2025, seniors' drug costs will be capped at $2,000 a year, saving seniors an average of $400 every year. And right now, Medicare is in the process of negotiating prices for 10 drugs, for some of the highest 10 cost drugs on the market. These drugs were selected in the first round, are taken by nearly 9 million people in America who spend $3.4 billion out of pocket every year, last year, on these drugs alone. This is a game changer for people with serious conditions like diabetes and cancer. Seniors in America are tired of paying 3 to 4 times more for their prescription drugs than people in other countries, and they will finally see change thanks to the Inflation Reduction Act. No longer can big drug companies charge whatever they want for life-saving medications, while seniors have to cut pills or skip doses because of high costs. The Inflation Reduction Act puts Medicare back in the driver's seat to deliver savings to seniors across the country. So now I'm going to turn it over, because nobody really wants to hear from me. Our first speaker is Harrisburg's own Mayor Wanda Williams.
Thank you.
Mayor, please go ahead.
Well, good afternoon, everyone. Good afternoon. And thank you to Mr. Berman, and a big thanks to our esteemed Lieutenant Governor. I'm sorry. The Honorable Austin Davis.
Thank you.
Okay, let me get that right. What you're doing here today says a lot about our leadership and character. We're grateful that you're putting such an effort into raising awareness and helping some of our most vulnerable and most valuable citizens, and that is our seniors. The reality is this: our seniors help build what we have here today. So it is incumbent upon us, the future generation, to take care of our seniors when they need it, because they deserve it. Now, I realize the irony in everything I'm saying. Yes, technically, I am among the 11% of Harrisburg residents who is considered a senior citizen. Although I like to say I am 60 plus, going on 25, and very seasoned. Yes. And we are talking today about legislation pushed by our 80-year-old president. All of this is to say, maybe, just maybe, seniors still know what they're doing. In all seriousness, though, thanks to President Biden's Inflation Reduction Act, we are proving that Medicare today is truly better than ever. I heard directly from seniors here in Harrisburg, some of whom were paying more than $200 a month for insulin. That is how people in America should be treated? No. That is not how Pennsylvanians should be treated? No. And this is not how seniors in Harrisburg should be treated. Today, thanks to the Inflation Reduction Act, they are paying under $50 per month for life-saving health care. The work being done on this Protect Our Care tour will help do more than save wallets throughout our city and the Commonwealth. It will help save lives. And as you start to enroll in your Medicare plans for the next year, we are here today to remind you that you could be saving thousands of dollars on your prescription costs. I started by thanking and welcoming our distinguished guests, and I close by welcoming and thanking all of you in the audience. You have shouldered the load your entire life. Now it is our turn to have your back and carry the weight for you. Thank you, and I now turn it back over to Mr. Berman.
Thank you very much, Mayor, and showing why I need to keep my remarks short. Next up, I will introduce very quickly your own Lieutenant Governor, Austin Davis.
Thank you.
Thank you.
Well, good afternoon, everyone. First, I want to thank Protect Our Care for today's event and the Medicare is Better Than Ever tour for being here in Harrisburg. I want to thank your rock star mayor, Wanda Williams, for standing with me this afternoon. To Commissioner Hartwick, thank you for being here and for your leadership on these critical issues to help move Dauphin County forward and for being such a strong partner for Governor Shapiro and I. And thank you to Christy Martin for being here today on behalf of the Biden administration. I was at the White House yesterday, and I know the president is committed to making things more affordable for our seniors here in Pennsylvania and across the country. A couple of months back, we were in Uniontown in Fayette County talking about the benefits of the Affordable Care Act and the Inflation Reduction Act with the Protect Our Care bus tour. And today we're in Harrisburg with even more good news. As the Biden administration recently announced the first set of drugs selected for Medicare price negotiation. That's a huge win for the American people. That's something that we've been fighting for years. And President Biden has finally delivered it to make sure that Medicare has the opportunity to negotiate drug prices. As we've witnessed the chaos in Washington, D.C. over the past few weeks as they try to elect a speaker, let's not forget that House Republican candidates for Speaker are all folks who have tried over and over again to take away our health care. Mike Johnson, who's the 5th Speaker designee this week for the House of Representatives, voted to repeal the Affordable Care Act. He voted against the Inflation Reduction Act, and his caucus wants to appease their big pharma donors and gut the law that's helping millions of seniors across our country. For Pennsylvanians who qualify for Medicare, there's a lot at stake. The Inflation Reduction Act is saving lives and will soon be saving Pennsylvanians millions of dollars each year on their prescription drug costs. The Inflation Reduction Act provisions for Medicare are really important for Pennsylvania. We have the 5th highest percentage of residents over the age of 65 or older. There are nearly 3 million Pennsylvanians covered through Medicare. Here are the benefits that have already started because of the Inflation Reduction Act. Medicare beneficiaries can now receive shingles vaccinations and other recommended shots completely free of charge. For the more than 80,000 Pennsylvanians on Medicare who depend on insulin, they are now saving money every month because the Inflation Reduction Act caps their out-of-pocket expense at $35 a month. There's no more gouging seniors with diabetes for their life-saving and sustaining medicine. And there are even more savings coming soon thanks to the Inflation Reduction Act. More than 800,000 Pennsylvanians will save an average of $467 each year in their prescription drug costs when an annual $2,000 cap kicks in starting in 2025. I know some folks may be on fixed incomes, but that's a big win for seniors here in Pennsylvania. As I mentioned earlier, Medicare can finally negotiate prescription drug prices. The Biden administration has started that process with 10 of the most popular high-cost drugs with the new prices taking effect in 2026. That's going to help more than 450,000 Pennsylvanians who rely on those drugs to treat conditions like diabetes, heart failure, blood clots, and arthritis. As Pennsylvanians get ready for the Medicare open enrollment, they should know these new cost savings are coming soon. For those Medicare beneficiaries who rely on insulin, your costs are now capped at $35 a month. And for those already covered by Medicare, go get your shingle shot if you've been waiting because it's now completely free. We must continue to do everything we can to drive down the cost of healthcare and prescription drugs. That requires taking on big pharma and the insurance industry. That's what Governor Shapiro and I are doing here in Harrisburg, and that's what President Biden is doing for us in Washington. You know, this issue is personal to me. I spent a lot of time growing up with my grandmother. She was a widow who was on a fixed income from my grandfather's railroad pension. And I saw every month how she balanced on whether she was going to pay for food, pay for medicine, or pay for the upgrades to the house that my grandfather bought 40 years ago and was in need of repair. This is an issue that affects real Pennsylvanians. It affects every person from all walks of life. Whether you're lieutenant governor, whether you're a person who has worked hard to provide for your family and you're on a fixed income, everybody deserves a little bit of relief. And I'm so grateful that President Biden and Democrats in Washington are delivering that. And I'm proud to be a partner with Governor Shapiro to help deliver that for everyday Pennsylvanians. And so now I'd like to turn it back over to Mr. Michael Berman. Thank you.
Thank you very much, Lieutenant Governor Davis. It is remarkable. We've got here today, sort of the city, the county, the state, and the federal government all here working together, trying to make Medicare better for everyone at this senior center and everyone in the state and the country. So next up, I want to introduce Dauphin County's Commissioner George Hartwick.
Thank you. Good afternoon, everyone.
Good afternoon.
I think you've heard about the details, and it's great to see the partnership that exists here from multiple levels of government. One of the things that I do know is that, and I'm going to give some practical advice. Politicians pay attention when seniors come together and are educated about the facts. Seniors vote.
That's right.
I want to commend the governor and the lieutenant governor and the department for taking a listening tour around the state about the needs of seniors to begin to reassess where we're at, because seniors in Dauphin County, which constitute about 58,000 residents in Dauphin County, are not doing better. There's issues related to affordable housing for seniors, and we're in a crisis. There's issues with rising taxes and not rising pensions. There are real concerns that exist between making life and death choices and whether or not you're going to feed your family, whether or not you're going to pay your mortgage, or whether or not you can afford prescription drugs. This is a little bit of good news in a time where there's real adversity and crisis, being able to cap some of these costs. What we want to tell you is we're willing to partner in these initiatives. We want to make sure that folks have the facts. So as the new enrollment period hits, you're going to be getting flyers and pamphlets from every provider under the sun. You want to make sure that you have an independent voice taking a look at your own concerns, not with a bias to which provider you select, but the ability to actually tailor a Medicare program to the specific needs that you have. And one of the roles that Dauphin County's Area Agency on Aging provides is the ability to do that independently, without any interest except for your own. We have a young lady named Shannon Valier who heads up the ability to assess and to assist you in personal appointments to be able to go through some rather confusing information. I know today I signed up in our open enrollment in Dauphin County for our own family's health care, and I'm gonna tell you, I have questions. I help negotiate our health care, but it's also important to understand that not everybody knows everything, and this is confusing. People are throwing a lot at you. There's a lot of ads. Make sure you take advantage of Dauphin County's Area Agency on Aging as you're making an assessment for that Medicare program and ensuring that you are doing what's best for you, not through a fancy brochure, but an understanding of your personal situation, your medical needs, and your household income. Those are critically important as it relates to the information. I also want to note that a lot of these changes we're talking about today, which you've heard, don't come into effect until 2025 and beyond. Now, the diabetes and the insulin cap is here, and I know we're negotiating caps on some of those prescription drugs as we currently speak. But a lot of these don't come online until 2025. Make sure you check in with Aging, and we want to check in with you as it relates to what you may be able to take advantage and the timing. But the main reason is I want to thank seniors for contributing and making the lives that we all live. You put in the work. You've worked hard. You've raised your family. You figured out a way not to point fingers, but you put yourself up by your bootstraps and figured out a way to make a better life in many ways for future generations. Now, at the time of your most important need, folks in elected office that are supposed to be representing you should not be turning their backs on you. They should be saying, how can we support you? What is it that we can do to advance your interests? And how can we better serve your needs so these critical choices aren't life or death, but are made in concert to be ensuring that you have the ability to have independence. You're not forced into a home. You have the ability to make choices over the future of your own life. After all, you deserve that opportunity. So I want to thank all the speakers here. This Medicare is Better Than Ever tour. Mayor Williams, Lieutenant Governor Austin Davis, all of us share the same background. We weren't born with silver spoons in our mouth. We're supposed to have each other's back when it comes in times of crisis. And ultimately, let us figure out ways to be able to serve you during your biggest times of crisis. And I want to hand out a number today of our Dauphin County Area Agency on Aging and Shannon Valier for all of you who may need help with determining that Medicare plan. Her direct number is 717-780-6130. And her email is svallier@dauphincounty.gov. I will make sure, for those of you who didn't get it down, I'll leave it somewhere with Les Ford to ensure that we have the ability to get that information for you after today. God bless you, and I appreciate your engagement and involvement. Yes. One more time.
Use the Evelyn Woods slow.
Shannon Valier, 717-780-6130. 6130. I heard you, Jess. Are we good? Dr. Scott? Thank you. Have a wonderful day.
Thank you, Commissioner. And as the Commissioner said, this is all very complicated, and it does take a lot of work. And we're very happy to be joined today by one of the folks who is charged with doing all that work and making all of this work for all of you. So I'm happy to introduce our final speaker, Christy Martin from the Center of Medicare and Medicaid Services.
Hi, everybody. Good afternoon. My voice is a little off today, and I apologize for that. Just thank you to Protect Our Care for putting this together. We're really excited right now because right now is open enrollment time in Medicare, and it's an opportunity for people to go in and make changes and find the coverage that's right for them and their Medicare. The open enrollment will last from October 15th until December 7th. So it's a great chance for people to take that opportunity to make changes to their health plan or their prescription drug plan, pick a Medicare Advantage plan, or return to original Medicare. With Original Medicare, you get your health care through Parts A and Parts B. You can join a separate drug plan to get your prescription drug coverage under Part D, and you can see any doctor that takes Medicare anywhere in the U.S. Medicare Advantage is an alternative that usually bundles your health and drug coverage all in one plan. Some plans may offer extra benefits that Original Medicare doesn't cover, like vision, hearing, or dental. And in many cases, you can only see doctors who are in your plan's network. Improvements to the Medicare program are adding up to savings and improved access to affordable treatments because of the Inflation Reduction Act. If you have Medicare and take insulin, you'll pay no more than $35 per month for each covered insulin now. This also includes people who get their insulin, whether it's through Part D or their prescription drug coverage, or whether they get it through Part B or their Medicare Advantage. People with Medicare drug coverage will pay nothing out of pocket for recommended vaccines. We heard a little bit about shingles, but this also includes the new RSV vaccine. And in 2024, starting in January of next year, people enrolled in Part D who have very high drug cost will get some relief. Once they reach a certain threshold on paying their out-of-pocket, what we call the catastrophic phase, they will no longer pay additional cost-sharing or co-pays at the pharmacy. This is leading up to 2025 when the $2,000 cap will go into effect. During open enrollment, you can compare prescription drug and health options. Plans can change every year. Even your current choice may have already been changing. Your health needs can change too. By comparing all your options, you could save money, find better coverage, and more. We are encouraging people with Medicare to compare their health and prescription drug coverage options to make sure that they have the coverage that best meets all their needs. You can go to medicare.gov to compare. You just input the list of prescriptions you are taking, and you can do a side-by-side comparison of plan coverage, cost, and quality. If you're happy with your current choice, you don't have to do anything. If you want a new option, you can enroll right there. If you need further assistance, you can always go to medicare.gov or call 1-800-MEDICARE. They're the official sources for Medicare information. We're here to help 24 hours, 7 days a week. Or find free personalized health insurance counseling in your community, as Commissioner talked about, with your state health insurance assistance program or SHIP And you can find more information there by going to shiphelp.org. Thank you so much, really appreciate it, and hopefully you'll find a new coverage that can meet your needs in open enrollment.
Thank you, Christy. So that's really it for today for the Medicare van tour. We appreciate you guys all coming out and hearing us out, and we look forward to hopefully making Medicare even better for everyone in the future. So thank you and have a good day.
Thank you.
So anyone who has an automobile and would like to enroll in the AAA free membership, please contact my office, 717, I'll do it very slowly, 255-3058.
I bet everybody knows your number already. Yeah, I'm just guessing.
They're free if you live in the city of Harrisburg, and it is for 1 year free, AAA. Okay? Thank you.
Thank you.